The irresponsible campaign against the vaccine of the University of Oxford, launched months ago not only by the Spanish government, but also by the European authorities, is now beginning to take its toll on us. The paradox is that while in communities like Madrid the vaccines of Moderna, Janssen and Pfizer are beginning to run out, the government has forced the return of AstraZeneca vaccines, up to 200,000 units, due to the prohibition that it be administered to children under 60 years. As the Minister of Health of the Community of Madrid recalled, Enrique Ruiz Escudero placeholder imaged this limitation as political and not sanitary, since the technical file of the vaccine does not impose a maximum or minimum age limit and the European Medicines Agency, EMA, itself recommends it for any age. In other words, at a time of tension due to the advance of the epidemic and a shortage of vaccines, the vaccination of citizens is arbitrarily stopped due to statistically derisory risks. As we have repeated in previous editorials, the risk of suffering a thrombus after being vaccinated with AstraZeneca is infinitely lower than that of falling ill with COVID and suffering serious sequelae after the disease. The figures are not good. The accumulated incidence at 14 days this Friday was 37 points higher than the previous day, up to 537.34 cases per 100,000 inhabitants. The advance of COVID, especially among unvaccinated young people, has been favored by the high contagiousness of the Indian strain of the virus and has brought the total number of infections since the beginning of the epidemic to 4,100,222 cases and 81,096 official deaths. In Catalonia, the community most affected by the epidemic at the moment, with a cumulative incidence of 1,160.42, the authorities have received judicial endorsement to apply confinement measures in 161 municipalities.